I want to welcome everyone again to our Healthy New Moms webinar series. My name is Roni, and I work as the Child and Family Program Manager for the Mental Health Association of Maryland. Healthy New Moms is a program of MHAMD that works to raise awareness of perinatal mood and anxiety disorders and offer support and resources to moms, families, and providers across the state of Maryland. You can learn more about Healthy New Moms by visiting mhamd.org. So today's session is being recorded and will be made available to you in the coming week. Certificates of attendance are available, and more information on how you can obtain those will be shared at the end. Due to limited public awareness and access, many people have little understanding of what doulas do or how they support individuals during pregnancy, birth, and the postpartum period. Our webinar today will provide an introduction to the Johns Hopkins Birth Companions program and the critical role of doulas in supporting expectant mothers, particularly those facing social or economic challenges. Attendees will gain a clearer understanding of what doulas do, how they complement medical care, and the types of emotional, informational, and physical support they provide throughout the perinatal period. The session will also explore additional perinatal support options and emphasize the importance of empowering women to advocate for their needs during pregnancy, childbirth, and postpartum. Practical guidance will be offered on how to access free doula services through the Johns Hopkins Birth Companions program in Baltimore and the DMV regions. So our speaker today, Carol C.J. Tomwe, is a graduate student at Johns Hopkins School of Nursing and a representative of the program, which provides free doula support to disadvantaged expectant mothers. In addition to coordinating and promoting community outreach across the Greater Baltimore and DMV areas, CJ also leads trainings on the birthing process, mental health, and postpartum care to help equip families with the knowledge and support they need for a healthy birth experience. So, CJ, I just want to welcome you again. Thank you so much for being here, and I will hand it over to you.
Thank you so much. Hello, everyone. Good morning. It's so great to be here. This is the second time I've gotten to work with MHAMD, so super happy to be invited back. Like Roni said, my name's CJ Toomey. I'm from the Johns Hopkins University School of Nursing. I am a fourth semester student in our MEN program, which is our Master's Entry into Nursing program. It's kind of a career change program or secondary degree program where people can enter the nursing profession without having a bachelor's or a nursing background. So it's been really great for me, and I am also a part of the Birth Companions program. I hold a couple student leader positions in the program, and it's been a fantastic way for me to get to know the Baltimore community, really participate as a member of the community, and get to be a bigger part of my school community as well. So I'm super happy to be here to talk to you about the program today, and a little bit about how our program ties into maternal mental health. So just looking at a quick overview of what we're going to be discussing today, I want to hit a few key points about what is a doula, how it may differ from other members of the pregnancy care team, what is our program specifically, what does our doula services look like compared to, other private companies, and other doula services you may find out there. Um, a little overview of some general maternal mental health topics, especially in the perinatal period, which we'll define a little bit later. Um, and then kind of using that information to help new moms and other care providers identify mental health needs in that perinatal period. I want to finish by giving you more information and tools on how to access our program if it's something you're interested in or if it's something that you want to share with anybody else you know that may need it. Um, and just really make sure that we have a good understanding of what Hopkins can provide. I do want to clarify before we go forward. Throughout the presentation, you'll hear me using she, her pronouns or referring to birthing parents as mothers. And that's not to discount or discredit any other people that give birth, whether it be surrogates or non-binary people or even transgender people. It's just a broad term that I use because the majority of the clients we serve do identify as female and use she, her pronouns. So just want to clear that up first. So, starting out, what is a doula? I'm sure a lot of people have probably encountered this before. It's kind of a holistic, naturalistic approach to birth. And it's different from what you may see in the care of a midwife or a nurse practitioner, a physician, a nurse, other members of the care team like that, in that it is non-clinical and non-medical. So, what the care we provide is not necessarily medicinal. We're not prescribing medications. We're not performing procedures. We don't even perform the birth, which is a common misconception. We don't we're not delivering the baby. We are strictly there for the support of the mother, and for the well-being of the mother, and to kind of moderate the environment in which the labor and delivery is happening. In addition to that, we assist in the preparation for birth and kind of the transition after delivery. Um, so it's different from a midwife in that we are providing a more emotional context to this. Um, they may be able to provide like medical care, like these are some meds that we can give you to help you through it. These are some different techniques that we can practice to make this a safer birth. Um, but we're really there to kind of create this holistic environment around that experience. So physical and emotional presence and support is a big part of the doula care. Um, we are not only tuning into the physical needs of the mother, like what positions may be more comfortable, more effective, what kind of comfort measures are going to be successful in reducing pain or, getting them through this one contraction. Um, but we're also there to tune into the emotional aspect of it, which is kind of what we're going to focus on today as well when we get to talk about the maternal mental health aspect. Doulas are trained to provide comfort measures throughout this whole process, but a big part of knowing which comfort measure to offer is being able to see in your client what is going on with them right now, what might they be feeling, not only physically, but emotionally, and how can I intervene in that to improve this experience. So really tuning into someone else's emotions, really acting in an empathic way, can kind of help guide us in what comfort measure we can use. And that really enhances our skills in being able to identify when there may be a mental health crisis occurring or some signs that a mental health crisis could be developing. Um, a big part of our work as well is in education and advocacy. A big chunk of this, for our practice at least, occurs in the pregnancy part, like before delivery, um, in that we are going through and saying, okay, here are our options. Here are some common things that happen. Here's what you can expect. Here are your different options for positioning, for pain relief, for your environment. So really kind of forming this team atmosphere where we get to learn a bit about what the mother may need, what the limitations on that are, given where they may be delivering. Different hospitals, different birthing centers have different policies and different things that they allow. Um, like for instance, certain hospitals may only allow 3 people in the room. So kind of working ahead of time so that we're not surprised with anything and not messing up our environment when we get to the birth. It's also a matter of here are our options for medical care, typically, because as we are trained in like what kind of medical things go on, we're not allowed to perform them, but we can inform on them. Um, so a lot of my discussions with clients involve like, okay, like, are you open to an episiotomy? If you have to go for a C-section, who do you want in the room with you? If you're not able to hold the baby, who is going to take the baby first? Um, those kinds of things. Do you want Pitocin? Do you want an IV while you're admitted? Just kind of going through all of the things that they can expect and should expect so that you know that you have choice throughout. So really that educational piece is very important to setting yourself up for success when it comes to labor and delivery. The advocacy piece is also very important in that we kind of act as the go-between. A lot of people don't have a high level of healthcare literacy or an understanding of, what the healthcare sphere involves. What kind of people are we going to be seeing in the room? What kind of things are they doing? What's dangerous? What's cause for emergency? What's the cause for, scare? Um, so kind of being that person that can translate between the people that are trying to do the complicated healthcare work and the person that is receiving it. Um, it's also, the opposite way as well. So the client says, I want this. Suddenly the plan changes. Something else has to happen in order to maintain the health and safety of the mother or the baby. We are the person that's going to be like, okay, like, I'm really sorry that this is happening so quickly. I know this is really scary, but here's what's going on. Here's what we need to do. Kind of refocusing and kind of limiting the amount of negative impact that that change may have. Um, so really just trying to keep the environment and the plan as close to the desired result and outcome as possible throughout that whole process. We also provide postpartum support. We're trained in breastfeeding and lactation. Not to say that there aren't more options for that, like there are lactation consultants and lactation specific doulas. There are postpartum specialty doulas as well. So they don't really do the labor and delivery, but they might come and do the care after delivery. They might offer more support in the breastfeeding area, in the mental health area. But we're also a great res person to go to for resources. So we can look at our clients and be like, okay, like this, I think this would really benefit you, and point them in the right direction of some other community resource that could benefit them. So really just kind of doing our best to improve the overall experience of our clients with pregnancy, with labor, and with delivery, and especially in the postpartum period as well. Because if you set yourself up for success in that whole time, we're going to have a better transition into motherhood and parenthood. So some resources we commonly point our clients to could be like actual material goods, like you need a baby car seat, you need formula, you need clothes. We have a lot of access and information about resources in the community that can provide that. But it's also things that are simple as like a support group or a breastfeeding group or a parenting class, a childbirth class, anything we can offer to best support you in the way that you may need. So really identifying those needs is a big part of our role. When it comes to the labor and delivery as well, we offer a lot of different comfort measures that may differ from a midwife or a physician. So like I said, we're not offering meds, but we do lean into things that are more naturalistic. So you'll see us offering massage, turning off the lights, putting on some music, aromatherapy. Pressure point massage is a big favorite of mine. Then there's also like the mental clarity aspect of it. We can do like some meditation, some focused imagery, guided meditations. And then we also have a lot of knowledge on various positions that we can put the mother in order to continue the progression of the birth and also like maintain the comfort. Just we're also there for like verbal encouragement. A lot of people like to use mantras throughout. So just really a lot of tools in our pocket to improve the experience. So a little bit about why our role is important. Um, we doulas have been shown to impact labor and delivery experiences significantly. So we're seeing 25% shorter labors. We're seeing fewer L&D interventions. So there may be a decrease in your need for a C-section. We see lower rates of C-sections in mothers with doula care. Fewer use of oxytocin, lesser use of oxytocin and pitocin to stimulate labor. Fewer labors that require the use of forceps. We also see improved pain management. So there's a 60% less request for epidurals. There's a 30% less use of other pain meds. So really, we are able to really improve the way that mothers are dealing with their pain throughout L&D so that we need fewer interventions as well. We've also been shown to improve maternal satisfaction with the pregnancy and birthing experience. And that shows up in a lot of different ways. It's not only being able to stick closer to your birth plan and have a more calm environment, but it's also in the postpartum period, we're seeing improved success with breastfeeding and the early attempts at breastfeeding. Infants are less likely to have low APGAR scores, which are the neonatal wellness checks, wellness scores in the first like 1 minute and 5 minutes after being born. Mothers have increased confidence throughout labor and delivery, and then as they move into the postpartum period and becoming a mother. Um, we're also seeing lower incidence in postpartum mood disorders. And then we're also seeing improvements in the way that mothers and babies are bonding. There's more affection shown from mothers to their babies that have had doulas than not. And this is really important for mothers' wellness as well as babies' wellness. So I just want to talk about our program a little bit. I'm going to play this video for you. This is from our 20th anniversary.
It's exciting, it's scary, it's overwhelming, but it feels like time standing still. You can be at a birth for 8 hours and it just doesn't feel like it. And then, when the baby's born, it's an unreal experience to see the family welcoming their new child.
Birth Companions program, first of all, it's a course. It's a 2 credit elective course that students can take as of their second semester. There are 6 classes in that course, and they learn how to provide support as a doula would to anyone who's pregnant during the pregnancy, during the labor, during the birth, and then support during the postpartum period.
So when the mother goes into labor, she gets this like call, we meet them at the hospital. And during that time, we provide support physically through comfort measures that we've been trained on, provide coaching through difficult parts of the labor. And we also provide family members and partners with support to help involve them also in the birthing process and support them.
So as a student, you learn empathy, sympathy. You also learn it's a lot of family bonding. So you're not just getting that educational piece as, oh, this is what happens when a mom goes into labor. This is how a birth happens. All births are different. So you learn something different and new with each birth and each family.
Birth Companions, I feel, is in a prime position to fill a very important gap so that women can have a positive experience during childbirth. And that includes having some.
I think the most important thing that I've learned is the power of positive support. That's been a skill that I think is just going to transfer into my nursing practice pretty soon. The one word that describes birth companions is support.
Advocate. Supporting what childbirth should be. A beautiful experience in everyone's life.
Okay. So that was just a little bit about our program from our 20th anniversary. The Johns Hopkins University School of Nursing Birth Companions program has been around since 1998. So we're around 30 years old at this point. It is a student-led program. So how it works is we have a course, a 2 credit course, like Dr. Lucas mentioned, where we're trained on what the birthing process is, both physiologically and psychologically, and what the doula role is and how it might fit into those processes. So we're trained on all of our comfort measures. We're trained on how to conduct our meetings with our clients, how to kind of incorporate ourselves into the birthing experience during the actual labor and delivery, and then sort of what our postpartum care should look like as well. So we're taught partially by professors and nurses at our school. So these are professionals in the field with experience in maternal healthcare. Dr. Lucas was an L&D nurse for several decades, I want to say. And then we're also partially taught by a working doula. So we used to be overseen and taught by DONA, which is the National Registry for doulas. But we're moving away from that and we're shifting to a more local doula organization. And so we are certified or will be certified through this organization. We used to be certified through DONA, and now we're going to be certified through the more local doula organization. So it is real life doulas that are training us as well as real life maternal nurses. So we're getting all of their wisdom and expertise passed on to us to take into our own practices. And then the program itself is student-led. So we have student leaders like myself that operate the phone lines, that operate the email. They operate our log, which is how clients are entered and assigned to doulas. And then we do the actual birth companion work. So we refer to ourselves as birth companions. We're technically doulas in the grand scheme of things, but for our program, we refer to ourselves as birth companions. It is a completely free service to clients in the Greater Baltimore area. So we're paid through our school. So it is a job for us, but it's free to the clients, completely free. Um, so Greater Baltimore area, not limited to Hopkins Hospital either, although we are associated with Hopkins and have a great relationship with their hospital system. We serve in hospitals and birthing centers, like all the way to DC, Annapolis, out in Baltimore County. And we have a running list of like a bunch of different hospitals that we regularly go to and have a good working relationship with. Roni, I don't know, I shared the brochure with you a couple weeks ago. Yeah. So I don't know if you guys have access to that yet or not, but our brochure has that list, as well as some of the earlier data that I shared with you if you want to review that after this presentation. But we have this list of hospitals and centers that we have worked at before. Not to say that we're limited to that list. If you are planning on delivering somewhere that's not on there, just let us know and we'll clarify the details and see what our limitations, our permissions are, and kind of go from there. We're totally open to working at new places. We've been really lucky to have students from all over the world. Hopkins is kind of this international magnet for education, especially healthcare education. So we've been really fortunate to have a lot of people in our program that speak multiple languages. So I myself am bilingual. I'm not a heritage speaker, but I speak English and Spanish. It's one of the things I studied in college. So I'm able to provide care in two different languages, but we also have students from other parts of the world that may speak a different language that's not English or Spanish, and that are able to provide care in that language, which is a really great thing because we do have a very diverse community here in Baltimore, and it's come in handy several times with a lot of different patients over the years. Um, Again, want to emphasize we're not providing clinical care. It's adjacent support services only. Um, so, just know what you're to expect from us and our services before signing up. But if you do have questions about it, it's something that we can clarify throughout the process. So what is our process? What we are instructed to do, and I want to preface this by saying that because it is student-led, there are some rules that we have to follow from our school. We are not allowed into our clients' homes. So typically when we're meeting with clients, either virtually over Zoom or Google Meet, um, or it's in a neutral location. So I've met with clients before, like at the hospital they're planning on delivering at when they're going in for a checkup or something. We can meet at the School of Nursing, which is right across the street from the Johns Hopkins Hospital. I met at cafes, restaurants, things like that, where it needs to be out in public is what our school requires of us. The other thing they ask of us is that we're always putting school first. So, one thing that we kind of work together as a cohort to do is that, say, someone with a client is they're going into labor, and the student, the birth companion, is at clinical, or they have an exam and they can't get out of it. They technically are not supposed to leave that. So we kind of work as a group and we communicate like, hey, I have a mom that needs XYZ. She's delivering at this place. This is, what her progression is. And so we kind of all work together to make sure that our clients have coverage no matter what, and that they receive the best care possible, even if it's not the person that they had been assigned previously. Um, so in general, our process looks like 3 meetings, can be more than that. The first meeting, or the first couple of meetings, is an introduction to us, to the program, getting to know each other, really forming that good relationship so that you can trust one another. And then identify and addressing concerns. So like I said before, a big piece of doula care is the education, of like the birthing process. Um, and that also looks like finding out where your clients' gaps in knowledge are, finding out what their worries are. How can you kind of dissuade those a little bit? How can you make a plan together to make sure that they have the best experience possible? So that also looks like creating a birth plan. Typically, we make our birth plans like 1 to 2 pages long, because the shorter it is, the more likely we are to like hit all the big points and get everything that we want. Um, and like it's a lot easier to communicate in a shortened format with the medical providers at the birthing place. Um, so creating a birth plan, we discussed like, what are your preferences for the baby's care? What are your preferences for your care? Who do you want in the room? Who is not allowed in the room? Those kinds of things to kind of limit the amount of surprises that we have when it comes to labor and delivery. So that's the during part, where we assist, advocate, and support the birthing parent. Um, so it's applying our comfort measures, the massage, changing the environment, the lighting, the music, that kind of thing. Communicating between the client and the healthcare professionals and vice versa, and supporting the client, but also whoever the client's partner may be, if there is a partner. So we are a great resource not only for the birthing parent, but for whoever else might be welcoming that child into the world. Because truly, we believe the best person to offer you support is the person you trust the most and that you know loves you. Um, so a lot of times we're not doing a lot of the work, like the physical hands-on. We're kind of guiding the birthing partner to here, put your hands here, here, put pressure there. Let's say this. Just kind of guiding that process between those two people rather than inserting ourselves if we can. So postpartum it's a check-in 1 to 2 days after delivery. We like to stay until the baby is born and then maybe 1 to 2 hours after, just to assist with that transition a little bit. At least, the golden hour, making sure that we can try and see the first breastfeeding attempt if the mother is deciding to breastfeed. And then we return 1 to 2 days after. So we're checking in on how feeding is going. How are you feeling? What was your experience like? Were there any like things that went really well? Were there any things that went really badly? Checking in on the mother's mental well-being as well, kind of how they're processing this whole experience, and kind of getting some feedback on our performance as well, because we are always looking to improve. Okay, so jumping into the maternal mental health portion of this, just a brief overview of some things that we see quite often. So this is a pretty common term, is baby blues. That's kind of the colloquial term that covers the mental, emotional impacts of the hormonal changes that happen in the postpartum period. So the perinatal period is the few weeks before birth and the few weeks after birth. Baby blues typically happens in the postpartum portion of the perinatal period. And I don't want to say that this is normal, because you're not going to feel normal if you're experiencing the baby blues. You might be a little concerned even, but I like to refer to it as more of an expected abnormal. You're going to be, experiencing a lot of hormonal changes during pregnancy and a lot of hormonal changes after pregnancy. So that immediate crash after really impacts the way that you feel. And this can last for a couple of weeks. When we start to see more maternal health concerns is with postpartum depression and anxiety and postpartum psychosis, maybe even some PTSD. And it's depression and anxiety, as we normally know them, severe worry, severe sadness that impacts your quality of life significantly. But it's complicated by this hormonal component, this chemical component that is specific and innate to pregnancy. Um, so it's really important to know like what risks you're facing in the postpartum period, mental health wise. Postpartum psychosis is incredibly rare. It is a risk, but it's incredibly, incredibly rare, and it usually co-occurs with history of mental illness or family history of mental illness as well. So just statistically, um, 10% of pregnant women experience maternal mental health concerns, and this is from the World Health Organization. 13% of postpartum women experience mental health concerns. Postpartum depression occurs in 1 in 8 women. So, from these stats, we can tell why this is such an important issue to educate ourselves about and to really address and incorporate into our pregnancy care, whether that be from a nurse, whether it be from a physician, whether it be from a doula, a midwife. Just kind of, it's the responsibility of all of us on the care team, including the client or the patient, to be an active participant in our mental health well-being. Um, why it's important as well is because mental health concerns in the perinatal period can negatively impact mother-baby bonding and infant well-being. Um, so imagine you're experiencing severe depression and anxiety while you're supposed to be caring for this incredibly vulnerable new life. This is a huge change that's happening in your life, and this person needs literally everything from you. So it can be incredibly difficult to be able to provide everything. So while you may be providing for their basic needs, they're, making sure they're fed, making sure they're clean, making sure they're sleeping, making sure they're breathing. The bonding portion of that is also essential to the baby's well-being. So if you're not feeling well enough to be able to show affection or make eye contact with the baby, because I mean, as they can see very little, but like reading faces and really tuning into the emotions and attitudes of the people around them is essential for their development. That the connection between baby and their caregivers is kind of crucial to their mental and emotional development and even their cognitive development in those first few months. So a little bit more about baby blues and differentiating that from a mental health concern and when to reach out for help. Baby blues, we're going to characterize it as mood swings, tearful episodes, feeling overwhelmed, anxiety, irritability, reduced concentration. And these are a result of the hormonal changes in the postpartum period. But also you can look at some of these like feeling overwhelmed. Yeah, you're going to feel overwhelmed when you
Partnership,
just
how
had a
that's
baby.
structured, how you actually form
Um, so what's also important to note about baby blues is this is going to be like a 2 to 3 week, maybe even 4 week experience. Whereas when we look at a more mental health concern, um, it's going to be lasting even longer. So 4 to 6 weeks, 4 to 8 weeks after giving birth. We're going to see a more severe version of baby blues. It's going to be severe mood swings. You're going to be crying too much. And when we're saying severe mood swings, it's not just, throughout the day, I'm going from happy to sad to angry. It's, abrupt and intense. So you may go from like sobbing uncontrollably to laughing uncontrollably. So when we see that shift, that's more of what we would consider severe. Crying too much, severe difficulty caring for yourself or your child in your basic activities of daily living. So that's hygiene, that's eating, that's sleeping. So significant decline in appetite, energy, sleep quality. If you're sleeping too much, if you're having some insomnia, if you're sleeping too little, loss of interest and pleasure in normal activities. A lot of people report a feeling of numbness. Um, so a lot of these symptoms, when we're looking at the mental health concern portion of the postpartum period, um, look very similar to what we recognize as normal depression and anxiety when it's not postpartum. So really just kind of incorporating your knowledge of mental health or, any, understanding of it before having a baby and applying it to yourself. Like, what am I on the lookout for? And not just passing it off as, oh, well, this is baby blues, because you know when something is wrong in yourself. Um, but it's also the role of the people around you to look for these things as well. So whether or not that's a medical or healthcare professional, whether or not it's a doula, a friend, a family member, we are all kind of responsible for looking out for these signs and symptoms of severe mental health concerns. Also important to keep in mind when we're on the lookout for these things, family medical history of perinatal mental health concerns increases your risk of developing them, as does environmental stressors. So when I say environmental stressors, we're really looking at the social determinants of health. Do you have a safe, consistent place to live? Do you have consistent access to foods? Are those healthy foods? Do you have access to healthcare? Do you have sufficient income to support yourself and the baby? Um, all of the things that can decrease our quality of life and increase our stress can also increase the toll on your mental health. So that kind of predisposes you to developing some of these issues as well. So the doula role in all of this, we have seen that patients and clients with doula care have a 65% lower chance of developing postpartum anxiety and depression and PTSD. So this plays a lot, ties into a lot in how doulas approach their services. We are on the lookout for the signs and symptoms of mental health from the jump. We're also on the lookout for what kind of difficulties and stressors are our clients facing throughout their care. So we can kind of jump in and address some issues before they become big problems. So when we're talking about those environmental stressors, if I see in my client like, hey, you don't have, enough things to keep your baby safe, I can point them to a community resource that can provide those things for them. So really kind of cutting down our risks throughout the entire pregnancy. We're also providing that educational piece. So we're informing clients understanding of risks, their warning signs, and providing preventative care for mental health issues. So putting them in a support group if we think they need to be in one, or suggesting it. I mean, obviously everyone has a choice. And then identifying perinatal mental health concerns. So again, we're trained to kind of identify where our client's at emotionally, which kind of enables us to identify when there may be a concern developing. The PTSD portion of maternal mental health is important to mention here, because birth trauma does occur. And so having a doula there can kind of mediate that a little bit, or mitigate that a little bit. So just a quick definition of birth trauma. It is physical and psychological injury that occurs during labor and delivery. Um, so this may look like something occurring that you weren't mentally prepared for. Physically, it can look like needing a C-section when you weren't planning on having a C-section and episiotomy. Birth is a very physical, more or less gruesome process. So even if everything goes well, it's still very invasive and very shocking to the body. So kind of coping with that can be a kind of trauma. Psychologically, if, there is a traumatic birth, something happens that was really scary, or, there's threat to your health or the baby's health, that can leave a lasting impact, and we can see that affecting the early stages of parenthood as well. So doula's presence may influence whether or not that birth trauma occurs, and how the client is able to process that trauma if it does occur. So our advocacy role step plays a big part here as well. We see a lot of statistics about women undergoing procedures during pregnancy, during labor and delivery that they didn't necessarily want to consent to, um, and having to undergo that anyways because of the chaos of the moment. Um, and we as doulas can step in and be like, no, 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 we need to everyone take a breath, take a step back. This is what our plan was. This is what's going on. How can we meet somewhere in the middle? So really advocating for our clients' best interest, for their wishes, can kind of cut down on the risk of birth trauma occurring as well. Processing trauma, a lot of times in labor and delivery, things happen that we don't plan for. Um, and that's okay because it is a very stressful, chaotic, kind of unpredictable physiological process at times. So if something occurs that the mother did not want to happen or wasn't expecting to happen, we can step in and be like, all right, like, I'm really sorry you're feeling this way. I know it's really scary, but here's what's happening. It's going to be okay. Like at the end of the day, there's going to be a baby. So let's fix, let's fix our mindset right now so that we can cut down on the trauma afterwards. Again, accessing and providing resources for our clients, identifying their needs, and pointing them in the right direction for those. So the doula does play a very important role in maternal mental health and mitigating mental health risks. Okay, so final portion of the presentation. I just want to do a brief overview of how to access our program. So if you scan the QR code here on the slide, that'll take you to our website. The website has the link to the video that we watched earlier, as well as a bit more of a blurb about our program, some of our contact information, but that's also listed here, our email, our phone number. Those are both good ways to contact us. The brochure also has a lot of information about our program, similar info on our contacts, and that I hope will be distributed to you after this so that you can utilize that as a tool. How our sign-up process works. Like I said, it's completely free. I also work the phone line, so I have an inside view of how it works. So you can contact us via the email or the phone number, leave a message for us. Like I said, we're students, so we're probably not going to be able to pick up the phone all the time. We're in class and clinicals and stuff. So leave a message. It should entail your name, your date of birth, so we know how old you are, your expected delivery date, where you're planning on delivering, who your care provider is, for your pregnancy care, and your contact info. So email, phone number, whatever you prefer. That kind of gives us a basis of how to enter you into the log. You can also let us know like any particular needs you have, if you have specific language needs, if you have specific healthcare needs, like if you have previous existing conditions that might impact your care. That's really important for us to know. And any specific concerns that you want to address, like I really want to have an unmedicated birth. I'm planning on having a C-section. My mother had a postpartum hemorrhage, so this is something that I want to address and prepare for. Things like that that might better inform our care of you. So once we receive all of this, we go and we grab all the information, we enter you into a log. The way the log works is, kind of up to our doulas, our students, where all of us go into the log and we assign ourselves to clients, not the other way around, because it's really based on availability. So birth companions will have maybe one or two clients at a time. And they just kind of assign themselves on availability. So how many clients do they have? When is the client due? Am I going to be able to make it when that client is due? So there is no guarantee that you can be assigned someone. But if you haven't heard back in like 1 or 2 weeks, you can poke us and we'll do our best to try and find someone that's a good fit for you. So yeah, and if we're not able to serve you, we also have a lot of resources to provide, as far as like preparing for birth, and then also other doula services that may have more availability. So yeah, are there any questions?
Thank you so much, CJ. That was such amazing information. We do have a couple of questions in the chat. Dominique asks, are you able to share which organization is certifying you all?
Oh, I can't remember her name. I can find it somewhere. I took the class so long ago, I don't remember the woman who came to teach us. But I can try and find it and I'll share it with Roni.
Okay. And then someone else asks, is there an opportunity for community-based organizations to partner with you all?
Absolutely. That is kind of why I'm here today. So I am the community outreach student leader for the program. And a big part of my role in that is to reach out and connect with community organizations, whether it be a clinic where we can get more, increased client awareness of our services, or people like Roni who we can use to share information or connect to different populations that may need us. Um, and then just like places that offer us services. So we have lots of community organizations that we work with and are trying to work with. Um, so I am definitely your girl if you want to make a partnership.
And is the best way that they can reach you that Hopkins email?
Yes, so that is the Birth Companions email.
And we'll send that out
I
as well. So.
Yeah, this is the program email. It's monitored by myself and a few other people that monitor our phone line. Um, You can also email me directly if that's easy, and I can try and put it into the chat if I can find the chat.
And then someone else asked, why the decision to not call yourselves doulas? I think you touched on that briefly.
It's just because we are a school student-led program, I think. Um, and I think it's also because it's like not our main role. Like we are birth companions. It's not our dedicated job, but it is something that we do as work. Um, So yeah, I think it was just a way to kind of delineate, we're students, but also do provide doula services.
And then I see Lauren, your hand is up.
Yes.
Hi, yeah, thank you. Thanks, CJ. I didn't know that you all went around the state. I was thinking it was only at Hopkins in Baltimore. I co-founded a nonprofit in Anne Arundel County. It's called Community After Birth, and we often are getting requests for doula support at reduced or no cost. So this is great to know that they might be able to access that at Luminous or the Glen Burnie location, the hospital there. So do you have any parameters over folks who are coming your way in terms of are you, I don't know, filtering them by like income or certain parameters, or is it truly just based on like who's available and the location and the timing?
Yeah, it's really who's available. We have literally zero requirements as to who can be a client, and there's no like priority system. There's no like first come, first serve type thing. We typically recommend that our clients contact us like 1 to 2 months out from their expected delivery date, just so that gives us time to enter them into the log, hopefully find a birth companion that's available to serve them. And that also gives you time to conduct those prenatal meetings as well. Um, so yeah, no parameters, no requirements based on income. We do, I mean, just by nature of where we are and the kind of services that we provide, especially that they're no cost, we do serve a lot of low income families, but we also serve a lot of medium and high income families. My first client was a surgeon. So, I mean, it could be anybody. It's like completely up to the client whether they want to pursue our care or, another doula service. So I mean, that's kind of the great thing is like we talk a lot about social determinants of health in our program. So kind of getting to see a very diverse community and serve them in this way is incredibly enlightening. It's really humanizing. Like we read a lot about it, but we don't get to experience it very often. So I think that's one of the beautiful things about the Birth Companions program. So yeah, I think a lot for our birth companions, like in choosing clients. I mean, we have people that come from all over. A girl that I know is like lives in Annapolis, another one lives in Pennsylvania, like they commute to school. So, it's kind of, we sign ourselves up for clients based on delivery date. So like what are we going to be available around then? Our, students go out of town sometimes. So like, should I sign up for someone when I know I'm going out of town? Probably not. But it's also the distance thing. So I typically sign up for a lot of patients that are clients that are more local to Baltimore because it's easy for me to get there at a moment's notice. But there are other students that live farther away where it makes more sense for them to sign up for somebody in near Annapolis, which is just
Okay.
another kind of benefit, I think.
Yeah. And then for postpartum after delivery, Is there a check-in process you all follow? Do you call? You said you can't visit their homes. I don't know a lot of people who want to leave their homes much
Right.
after delivery. So how does that work?
The way we were recommended to do it is to go the day after birth and visit them in like the step down unit or the like mother baby unit, just to check in that way. But if that's not something the client's open to and it's not something the client's ready for, the Zoom meeting is probably the best option, just because we also know that it's not recommended for babies that young to be out in public. And we wouldn't want to ask that of parents either. So, yeah, the virtual option is probably best if they don't want the in-person hospital visit the day after.
Awesome. Thank you.
Of course.
Thank you all so much. Any final questions for CJ and the Birth Companions program? Let me see in the chat. Okay, I see Gina's hand is up.
Yeah, just a quick question. Do any of your students go on to become doulas after the program?
Yes, we actually have some students that were doulas before the program too, or worked in other kind of services around maternal care. Um, we have a lot of students that go on to become labor and delivery nurses and like maintain their doula role within that, and then also separate from that. Um, and then we have a lot of students that continue to like be a support person and a resource for new birth companion students. So a lot of the people that like help out with the program and like the leadership portion of it are already graduated. So because we are kind of shorthand in like a couple of the leadership positions. So they're like, well, I'm here if you need me. Like I'll be in the area, just reach out. So yeah, we do maintain a lot of our doula roles. Maybe it's not always working as a doula, but kind of being a support person in one way or another is pretty common.
Awesome. Thank you all again so much. And I want to thank you again, CJ, for your presentation. We will send out the brochure and the resources that you shared with us today to everyone. You will receive a follow-up email with the link to the recording as well and a survey asking for feedback on how we can improve these webinars. As I mentioned at the start of the call, certificates of attendance are available. That link will be posted in the chat. We do not offer CEUs at this time, but you can request a certificate. If you're interested in serving as a guest speaker for an upcoming Healthy New Moms webinar, please click the link in the chat below and someone from our team will reach out to you with more information. And please feel free to join us at our September Healthy New Moms webinar happening September 2nd. The title is The Impact of Intergenerational Transmission of Trauma Between Mothers and Children and Implications for the Care of the Family. We look forward with working with you all to support mothers and communities across Maryland. And if you have any questions about Healthy New Moms or the webinar, feel free to contact us at info.hnm@mhamd.org. Thank you all so much and have a great rest of your day.